All right. Well, good afternoon, or yeah, good afternoon. I guess it's afternoon everywhere. My name is Davis Patterson, and I am research faculty at the University of Washington in the Department of Family Medicine, and I'm joined by Randy Longenecker from Ohio University Heritage College of Osteopathic Medicine, and we're delighted to see a nice group here for our webinar on micro-research for technical assistance. First, I want to acknowledge that we are funded, this project, Rural Prep, is funded by HRSA, and we're very grateful for that funding. We also have to issue a disclaimer that we're sharing our opinions and information, but I will say that HRSA is very supportive of micro-research. So Rural Prep stands for the Collaborative for Rural Primary Care Research, Education, and Practice, and we've been around for 4 years now. And our mission is to improve and sustain rural health through community engagement and research in primary care health professions education. We have 3 main aims, and one is that we conduct our own research, but we also promote research, and micro-research is part of that effort. And we disseminate research and tools and evidence-based practices related to primary care health professions education. And then we're trying to build a community of practice, and that means learners and faculty and interested rural stakeholders and educators around the country that share the same mission that we have. We are a collaborative project between the University of Washington, my institution, Randy's institution, Ohio University, University of North Dakota, and then we have a number of other partners such as the National Rural Health Association and others. During the webinar, we don't have a lot of slides, and so we'll go into some detail, but we will not take anywhere near the hour with our slides, so that we can save time to be interactive with you and to take your questions. And so please do use the chat box at any point if you have questions. As we're presenting, we may not see them, but we will definitely get to them at the end if we don't address them during the presentation. And you can find that if you're not, I think we're all familiar with Zoom now, but if you're not, either at the top or the bottom of your screen, depending on the view that you're in, if you hover, the menu bar will come up and you can see the chat box in there. And so I'm actually trying to, I see that there's something in there now, so I want to make sure. Okay. All right. And I'm going to turn it over to Randy to talk a little bit about what micro-research is and where it came from. You're muted, Randy.
Good afternoon, everyone. What is micro-research? Actually, it's a term that we borrowed, I like to say, from another organization who has been using this since 2008. Folks at the medical school in Halifax and in Dalhousie University have partnered with folks in Africa, health professions programs in Africa, to fund small projects. And they use the microfinance concept, which some of you may be aware of, from the Grameen Bank in Bangladesh, where small amounts of money are used to fund, to provide seed money and fund startup capital for women who are starting their own business, a sewing business or whatever. They took that same concept and applied it to health professions, education and training and research, and combined it with a mentoring program and a learning community. And when we had the opportunity to write this grant, we thought that this would be a great way for us to promote research among students and residents, and to do it with a small amount of funding. In Africa, next slide, please. Or do I have, there you go. Back one, please. In Africa, the amounts are in the range of $500 to $1,500. In America, it's $4,000. But here are the founders, and their inspiration, as I said, was microfinance, the microloans to the poor, and their mission is to improve healthcare outcomes with innovative community-based research that integrates research into the fabric of the local health system and the community. And so in our version of micro research, we've made an effort to take the same approach. Next slide. It's now been replicated around the country in Africa. Here's a program in a family medicine residency in Kenya that actually is funded from a US grant and local funding, as well as the large list of funding partners that the Micro Research organization has acquired over the last 12 years. Next slide. So Rural Prep's micro research funding opportunity is similar, but in a lot of ways different. And it's also different from traditional research. We've just opened up the application. This is our 4th cycle for this coming academic year, July 1 through June 30th. And we've learned some things over that time. We've adapted our approach to things that have come up. But it differs from the African experience, and not just the amount of money, but in the way that we chose to distribute the money. One of the problems we have in the US with grants are the large transaction costs of grant management. And so doing something like micro research, Rural Prep micro research project is across multiple institutions across the United States could be administratively very expensive. And so we figured out a way to make the transaction costs less, so that in fact the total amount of funding required would be less. Next slide. Our approach is that locally generated and implemented projects in your community in pursuit of local solutions to a local problem in small rural places with a small amount of funding results in a big impact. And that's been our experience so far. Next slide. So applicants can apply for up to $4,000 per recipient per grant year from July through June. It is a reimbursement mechanism. Awardees actually become vendors of Ohio University, and we are able to use our vendor system and very rapidly provide you with reimbursement for costs. The funding is designed as a reimbursement, not a traditional grant. We don't give you $4,000 and then a year later ask you to come back and tell us what you did with it. Instead, we pay you as you incur costs. So the principal investigator, the student, the resident, the learner who is being awarded this grant must actually incur the cost and keep receipts and supply those to us so that we can rapidly turn that around through our system and hopefully get you paid before your credit card comes due. It is possible to have projects across more than one institution, but we ask that there be a single project lead at each institution, and we could give an award to each of those individuals. So you could have 3 institutions, 3 individuals, each with up to $4,000. Next slide. To be eligible, you have to be a student in either medical school or nurse practitioner or physician assistant program, as the focus of this rural prep grant is primary care. Residents in a rural family medicine or internal medicine residency program, for example, would also be eligible. And other health professions training for primary care who are practicing in a rural location would be eligible. An example of that is one of our recipients who is a naturopath or naturopathic student. The definition of rural that we use is two federal definitions, not including the Census 2010 % rural criteria. And you can find out any address in the United States by just typing "Am I rural?" into Google and then putting your address in there, and you'll find out whether or not you're rural. Next slide, please.
I think I just wanted to say we do get questions about what the rural how to figure out the rural definition. So please, do let us know if you're not sure how to use that tool. It's not self-evident necessarily. It's not too hard either, but let us know if you have questions about that.
Absolutely. If you go ahead, your turn, Davis.
Okay. So we do get questions from folks fairly often who don't fit into one of those categories that Randy outlined. So there might be a urban physician resident, for example, or a faculty member who has an idea, or somebody that's not, a physician, NP or PA, not a primary care clinician per se. And so what could you do if that's your situation? You could partner with somebody who is eligible. So that would be finding one of those eligible applicants. And then they would be the lead of the project. And so you would be, you could co-lead or be in assistive capacity, but they would be the primary grantee and or the awardee, and they would be the one that you'd need to work with. And so we do encourage that kind of collaboration. Our eligible topics, really, it is rural health, and we've seen quite a variety. Primary health care, population health. We're particularly interested in health workforce education and training because that is core to our mission, but other rural health topics are also eligible. And here are some examples of past projects and a current project. Group medical visits for chronic pain in a rural primary care setting. That was actually an interprofessional project with a physician, a DO student and an NP student, husband and wife, who did that project. So we like the interprofessional aspect of it. And other projects, how are rural communities affected by the loss of a physician? A study of family medicine rural residencies in terms of their use of technology-based remote learning modalities. A study in New York State on the impact of that state's healthcare budget cuts on rural communities. And then projects looking at barriers and opportunities that gender minorities face in rural healthcare. And so you can see a wide variety of topics and populations of interest within rural settings. We prefer research that's community engaged with some kind of community involvement. That could include a commitment of in-kind community contributions, and I think the reason we prefer that is that that shows a commitment on the community's part. We also prefer or give preference to projects that are collaborative across health professions. As I mentioned, the NPDO project, or across different institutions, different schools, or a school and a residency. So those are funding preferences. They are by no means requirements, and many projects that we funded, do not fit those, but we are particularly interested to see these kinds of projects. If you have a faculty mentor identified, that's great, and you can indicate who that is in your application. Or if you don't, that's fine too, and we can work to find one for you. And that will have no impact on our funding decision. So you don't have to have a mentor already identified to do this, but if you do, that's great. And I think Randy, this is something for you to talk about. So let me turn it back to you.
You bet. Yeah, I think it does work best if you have a local mentor. We now assign one of us rural prep researchers as an advisor as well. So you get an advisor and a mentor. And the recipient and the mentor are both expected to participate in the micro-research learning community meetings that we have once a quarter, every 3 months, after an initial orientation. And during these times, we meet at 9 p.m. Eastern time, so that even our one micro-researcher from Alaska was able to participate across time zones. And we take about an hour to share projects, give feedback to one another, problem solve together. Sometimes we'll invite an expert to the meeting if a question comes up that the group wants to address. And so it's been one of the more popular parts of the micro-research project. Next slide. Eligible expenses. We are constrained by the federal government and what we can reimburse for. And so if you want all the gory details, you can go to the hyperlink at the bottom there. Equipment is an eligible expense, all sorts of supplies, including the printing of a poster when it comes to the end of your project. You can give incentives to research subjects, although we discovered that giving online Amazon cards is not a good idea. One of our micro-researchers was hacked by folks who figured out it was an easy way to get some money. So there are some ways that we can get around that. You can register for a short training course, and we can pay for travel, including a per diem rate for meals and lodging if needed to travel to a community and to better engage in the community. Salary is not an eligible expense. We cannot pay your faculty to help you, and we cannot pay you for your time. Again, these are incurred expense. So you would have to pay for the equipment and then send us the receipt and we would reimburse you. Next slide. Other requirements: the research should be completed within a year or less, and then disseminated within 2 years of award. Obviously, there are exceptions and hardships that come up that we would consider, but that is the expectation. And if you are successful in being accepted as a podium or poster presentation at any U.S. regional or national conference, you're eligible for an additional $500 in travel support. You are expected to do quarterly progress reports and an end of grant year report the first year, and a final report on completion of the research with some reflection on that experience. And this micro-research strategy is meant to teach you a lot of the pieces of grant writing, grant management, grant reporting, etc. And so I hope that you'll find these requirements actually a help to you in better learning how to complete a research project. I think you're up, Davis.
Yep. So our application is now open on our website, and the deadline is next month, May 26th. So you've got a good amount of time to think about what you want to do and maybe partner up and connect with the community or what have you. We will provide full guidance, or we provide full guidance for the application, and that includes a proposal template and a budget template online. And really, we want the application process to be a learning experience for you too, because we imagine that most, if not all of you, have not applied for something like this before. And so, so we are very supportive of this as a learning process for you. The proposal template, there's much more detail in our guidance about these sections, but we want to know what's the background that's motivating your project? What's the key health issue or concern or situation that's going on that needs, that calls out for the study that you propose? And then what are the research questions or your hypotheses about that issue that you want to investigate? What methods do you plan to use? And if it's qualitative or quantitative, that's okay, or both. But say something about how you're going to get the data, what you're going to do to analyze it. And then what are your expected products? What are you wanting to get out of this at the end, including for dissemination? And we do want you to disseminate your work in some capacity. And then finally, a timeline of major milestones. What are the key steps along the way in getting your project done? Our budget template looks like this, and so we have a place for you to describe expenses broken down by category, and then how much money you're requesting for each line item in your budget. Also, we've got a place for you to note, you know, if rural prep funding alone won't be enough, or if it's an item that's not eligible for rural prep funding, but you're going to be contributing that yourself, and that's needed for the project, then by all means put that in there. I mean, we want to know what contributions you're making, if that's applicable, as well as if you have any other support that's being provided by someone else. And then there's a space that's very important there off to the right, where you provide a short description of you know, what that expense is needed for. Sometimes it's fairly obvious, but it's okay to state the obvious again. And then I just want to go through sort of oh, go ahead, Randy.
I just wanted to point out that each of these templates is a download from the actual application. So you'll need to start the application and you'll go into REDCap, and these are downloads from that right at the beginning of the application. You can download those, leave the application, and then come back later to complete it.
Yeah, that's a very good point. Thank you. We have a checklist in our guidance, and but I wanted to just review some of the key things here that you know, we get questions about, or we'll get an application and have seen that somebody, you know, didn't clearly address in their application. So we want to make sure, first of all, that you're eligible for the award. And so if you have any questions about that, please let us know. Do you have a population or a community or a geography of interest that meets that rural criteria that we were talking about? Did you say in your application, how is this a rural topic? So our example there is, you know, lead exposure is a problem in many different places, and it's not necessarily restricted to a rural issue. And so, you know, we would want you to explain, why is this a rural concern in particular? What's the angle on it that's rural or rurally relevant? If your project is a research study or some kind of evaluative study that uses research tools, then that's great. But if it's purely an intervention or a health promotion project, those are great things. But without a research or evaluation component, a study question that you're trying to answer, that would not be eligible. So, so you can have an intervention as part of your project, and you can be studying that, but the intervention all by itself would not qualify. Is your timeline of key activities clear, and does that include IRB review? And I would say it's almost always needed. It may not be needed in some special cases, but it's almost always needed in some way. And also, I would try to find out, get a sense, particularly now during COVID-19, IRB review can take even longer than you might think. And so try to get a sense of that so you can develop a realistic timeline that includes that. That often is a source of delay, even for experienced researchers like me, that we think it should happen faster, and it sometimes doesn't. Is your project of a scope that you'll have a chance to really get it done within a year of notice of award? So in other words, within the July to June timeframe. That doesn't mean it has to be disseminated. We give you, up to an additional year to disseminate your results, but to have the study with complete results within that year timeframe. Have you described all of your activities and provided some rationale for, who's your target population, what's your sample size that you expect, how are you going to recruit study subjects if you're doing primary data collection, how will you collect data from those subjects or about them, and what are the analyses that you're going to conduct? If you do plan to do this as a team, and we think that's great if you do want to do that, then please describe, list your team members and describe what everybody's roles and contributions are going to be, including your own, so that we can understand what the team consists of. And if you have any partners in the community, it's always a good idea to make sure that they're on board to participate. So if there's a key community organization, for example, that needs to be brought on board, try to see if you can, approach them and let us know that you've done that. And then we have a 2-page limit for the application, and it has, clear formatting requirements, and so make sure that you follow those requirements. References are not included in that, so you can start those on page 3. And this is the contact information for me and Randy, as well as our dissemination lead at University of North Dakota, Dave Schmitz. He is also deeply involved in micro-research, and we'll be reviewing the applications together. And so, feel free to reach out to whichever one of us is most convenient for you. We are happy to hear from you. You can also reach out through our website. And we really do encourage you to, don't hesitate. As I said, we want this to be a learning process, and, rather than struggling with an issue for 2 weeks and losing time on your application, feel free to check with us, and we'll be happy to assist you in whatever way we can. And so that concludes the slide presentation portion of today. And I see there's a question in the chat box. And so I encourage you to use the chat box if you have other questions. I think before I get to that question, I'll just ask Randy if there's anything else that he wanted to add based on what we've talked about, anything that I've missed. But then I'll get to the question in the chat box.
I did want to point out that although IRB approval or review may not be required for purpose of publication and such, it is a requirement that either the IRB determine that your study is exempt from human subjects review or reviewed in order to be a vendor under our Bobcat buy system. So we do require some evidence, and that can be a simple document that many IRBs will give you saying your project was exempt, you're studying anonymized data that already exists, and you're not obviously working with human subjects. You don't need an IRB review, but it's nice to know that the IRB committee thought that.
And that is a really good point too. And I had forgotten about that piece of the vendor and reimbursement requirement. There's one situation that, and different universities handle this in different ways, but if your study is actually not human subjects research, there are some IRBs that will not indicate that. In other words, you have some process that you use to determine that. But if you had an email exchange with the IRB and they said, well, we don't review studies that are not human subjects research, I would hope that would suffice. So that's the one little tiny exception, but that will probably not be the case for most of the studies that you would propose. So that's a good point.
Yeah, an email exchange would be acceptable to us.
Mm-hmm. So we've got a couple of questions. The first one is, if we want to test a sports medicine application being developed to increase physical activity, are we still eligible for the fund? And this particular student is in our UW Trust program and currently working with UW Sports Medicine Clinic and with a rural clinic to test the app. And I'd say absolutely, that is an intervention, and if you're asking research questions about that and it's related to a rural population of interest, I think that could be eligible.
In fact, we have a student this current year who did an intervention in an urban place and a rural place, and then compared the two populations and the experiences from the two settings.
And then the next question is, if my project is set up to be continued for the foreseeable future, could I just have a goal of a specific number of surveys to be completed by a certain date? And so this sounds like makes me think that this is maybe part of a larger study that someone is involved in, if it's already set up and running. And so what I would say, I guess I'll run a couple scenarios, and Randy, you might have some ideas. So there may be a case where, for example, there's a faculty member that's doing a study, a bigger study, and you have an opportunity to take a piece of it or add a piece to it that could be a micro-sized research project. So really, it's important, first of all, that this be a project that you, the applicant, you are the lead on this. And so that would be okay for you to add a component to an existing study and carry out that study. But we would want the study to be initiated and completed, your piece of it to be initiated and completed within that year. If it's already a going concern and it's going to continue into the future and it's not going to be a completed piece of research, then, funded by Microresearch, then I wouldn't consider that to be an eligible study. But you may want to reach out to us to talk about the specifics of your situation, or if you can describe it more completely in the chat box, and we'd be happy to talk that through with you. Did you have any other ideas about that one, Randy?
Well, I know that one of our micro-researchers did a study and was not able to complete it in all of its glory in the year that she had, but a next year student came along and took it up, another piece of it, and was then the awardee for the next year. So it is possible to pick up an ongoing study, but your part of it needs to be segmented and needs to be clearly identified so that it can end in the appropriate time. And the funding for this does end June 20th. Since it's a reimbursement mechanism, we need that last 10 days of June to make sure that you get reimbursed in the academic year.
And I guess the thing that I'll say about that particular study is it was intended to be a one-year project and had significant delay for reasons that were beyond the control of that student. And so, but in the end, she did get a product out of it, and then it did continue on with, more work after that with another student sort of carrying it on. So, but it is meant to be, you know, if you're mid data collection and it's not going to be finished, like surveys are not going to be finished for, you know, beyond the June survey and analysis not finished before June of 2021, then that would not be an eligible timeline. So your timeline needs to indicate, you know, the project completion with analysis complete by June of 2021. And I think some folks are saying thank you and signing off. Any other questions? I don't see any other questions coming up. One thing that I did want to say too, knowing from my own personal experience doing research with the pandemic, you know, there have been a number of projects that I'm aware of, including a couple of my own, that I've had to completely either change or stop because it was not appropriate to continue. And I do health workforce research, and people who are actually providing healthcare are very busy right now. Some of them are not so busy, but a lot of them are busy. And so I've had to change, you know, sort of stop in my tracks and rethink things. And so just be aware, you know, I'm sure that you will be thinking about this, but have in mind the unknowns with COVID-19 and try to, you know, build extra time in. There may be times when certain kinds of research is more appropriate or less appropriate during the year in terms of engaging human subjects and that sort of a thing. So, and of course, whether that can happen in person or not is another question that you'll need to be thinking about as you design your project. So we'll have to see.
I did want to say that the three of us are listed here as the three researchers and leads in this project, but we are surrounded by a larger team. For example, one of our learning community events in the last couple months included one of the biostatisticians from the University of Washington, because we needed to answer some specific questions. And so we brought her and invited her into the learning community. I have a colleague, Sharon Casapula, who's on the call today, who will also be working with us over this next year. Her expertise is in qualitative research. And so we will draw on other expertise as needed to help you with your project.
Any other questions? Now's your chance, or tomorrow, or anytime before the application due date.
I will say one other thing, and that is, unlike most large grant applications, once the deadline has come, we will fairly quickly review those, and often within a week or two are getting back to you if we see some ways in which it could be improved. We may approve an application right off the bat, but we want this to be a learning opportunity for you. And so if we see that by tweaking this or tweaking that, you can make it a better project, we'll suggest that. We'll give you feedback and send you a feedback form and allow you to make those additions or corrections, or even go beyond what we had asked for and resubmit before we make a decision about approval or not approval.
All right then. Well, seeing no more questions, we are very glad to see that we had 15 or 16 folks on the call today, and we hope that we'll get applications from all of you with great ideas for micro research for the coming year. and please do reach out if you need any assistance over the next month. And I think that concludes our webinar. Thank you.